So there are, last time I talked about the 6 layers of the cortex. Yun siguro yung I thought hindi ko siya masasama pero nandito pala siya sa chapter na to. So I'm glad. Kasi feeling ko when I said that there are 6 layers in the cortex, parang hindi niyo siguro yun naintindihan. So yung cerebral cortex is the largest portion of the central nervous system. Sobrang lapad niya. But little do we know about this cerebral cortex. Kasi wala namang nagko-consent. Sino bang magko-consent na you will be, parang yung skull mo bubuksan and then we will study your cortex and then eventually you will die. Parang, di ba walang mag-volunteer for that. So how do we understand the cerebral cortex? During neurosurgery, they try to give an electrical impulse or stimulate a certain portion and then it will evoke some impulses. Yun nalalaman natin yung functions niya. Or if there is an infarct on that area, damage in that area based on, let's say, anatomical findings on surgery or based on MRI, and then correlate that with the damage in the periphery, then doon natin naintindihan yung function niya. But if the brain cells are alive, if these cerebral cortex neurons are alive or not broken, we really do not know the exact mechanism how it functions. That's why there is still a large investigation that we have to do to understand the cortex. Nevertheless, the most important findings, alam natin. So when we talk about cerebral cortex, ano siya parang it's a thin layer lang siya, hindi naman siya masyadong thick, about 2 to 5 millimeters in thickness, and there are about 100 billion neurons. So para maintindihan niyo siya, it is labeled into 6 layers. So the first layer is the granular layer, and it's called the granular layer because the neurons there are small in structure and the axons are small. So these basically are functioning as interneurons. So alam niyo naman pag interneurons, di ba? It just interconnects from one neuron to the other. Yun yung function niya. So these pag interneurons, these are more, the granular layer is more thicker in the sensory area as compared to the motor area and the cortex. So by that, you know that the sensory area is working a lot through interconnections with the synapses coming from the central from the spinal cord, thalamus, and also with the cortex. Kaya siguro mas thicker yung granular layer in the sensory as compared to the cortex. So the next layer is fusiform and pyramidal, and that's because the fibers there, the neurons there are fusiform in size, and the third layer is pyramidal. So alam na natin, we have discussed last time about the pyramidal cells. These are the cells in the motor cortex, primary motor cortex. Ang haba ng axon niya, kahit minsan nga, it reaches up to the spinal cord level. Yung corticospinal trunk from the primary cortex down to the spinal cord until it synapses with the interneurons in the spinal cord. Ganun siya kahaba. So these are motor output or output fibers from the cortex. So I have your book 6 layers, so from 7, and I have summarized the functions in each layer. I said layer 1 is more of interconnections. Yung area 4, that's the primary motor cortex. That's where the sensory signals terminate in area 4. Whereas layer 5 and 6, in layers 5 and 6, that's where the motor output exits. So in layer 5, more on the output going to the brainstem and the spinal cord, and area 6 more on going to the thalamus. So that's basically the layer. So from superior to inferior. And then we also have this, if you look at the picture, yung image, there are mostly are vertical siya, no? Vertical yung layers, yung synapse. Well, hindi ko siya maturo pero there is that on the right side on your picture. Meron siyang horizontal layer of fibers. So that's association one. These are fibers connecting from one area in the cortex to the other. So hindi lang siya, almost most of the fibers are going down or vertical, but there are also fibers or synapses going to the other sides, and that would appear as a horizontal fiber. Okay. So I will not discuss the primary sensory, primary motor, premotor in this lecture because we have discussed that in the previous lecture. So as you can see from the cilium fissure, you have posterior to that the primary sensory, and then anterior to that is the primary motor, and then you have the premotor and supplemental motor, which we have discussed in the previous chapter. So we will highlight naman in this lecture yung association areas. These are areas in the cortex that have different functions as compared to the primary motor, supplemental motor, and premotor. So the association areas, there are three. First is the Parieto-occipitotemporal association area, and second is the prefrontal association area, and the last is the limbic association area. So anatomically, yung Parieto-occipitotemporal association area, if you look at the position, tingnan nyo na lang yung picture. Anterior to that, you have the somatic area. And posterior to that, you have the primary visual area or the occipital lobe. And then lateral to that is the auditory area. So nandun siya sa gitna. Napakalawak niya. Parang if I have to remember that, para siyang China, no? Laki niya. So prefrontal area is in front, no? So the anterior to the supplemental and premotor area. Ang laki din niya. In fact, if we have to compare the prefrontal area in human and in monkeys, mas malaki daw. We have a bigger prefrontal area as compared to monkeys. So for a longer period of time, we thought that the intellect of humans is because of this damage to the prefrontal area. The intellect is still preserved. So we now know that intellect is not in the prefrontal area. There are other functions of the prefrontal area, but not really on the entire intellect of human beings. Okay? Limbic association area, we will talk about that. So isa-isahin natin. Parieto-occipitotemporal area. Tama ba? Pangit ang pagkakasulat. Association area. So it provides a high level of interpretative meaning for signals from all the surrounding sensory areas because it receives sensation coming from visual cortex, auditory, and also from the sensory. Kaya siya nandun sa gitna. So if you can see the area of the Parieto-occipitotemporal area, association area, it is the coordinate of the body and surroundings. It has the visual processing of words. We know that it's the angulate gyrus. We have meaning of objects. So isa-isahin natin yung functions of this Parieto-occipitotemporal association area. Okay? But interpretation, it receives signals from vision, from auditory, or coming from somatosensory, and then interprets it. So that's the function of Parieto-occipitotemporal association area. Okay pa bang signal? Okay, spatial coordinates of the body. So if you try to fit yourself in a half-closed, parang half-open door, kaya mong magkasya, no? You can easily fit, you can adjust your body to fit in that half-open door. Or if it's a crowded place, hindi ka naman babangga to the other, parang other people. Diba hindi ka bumabangga? Kasi na-adjust mo yung katawan. You have an idea of your surrounding. You have an idea of the position of your extremities in relation to your surrounding. And that's because of this analysis of the spatial coordinates of the body. So this area receives visual, sensor information from the posterior occipital cortex and simultaneous somatosensor information from the anterior parietal cortex. Ito naman yung information coming from the periphery, okay, from the skin going into the primary or secondary sensory area, and then some signals arrive or synapses with the Parieto-occipitotemporal Association area in order to analyze the position of your body, okay, in relation to your surroundings. So it computes the coordinates of the visual, auditory, and body surroundings. Okay, angular gyrus. This is important for analyzing visual language. When you are reading a book, you are not receiving the information in form of a picture. But what happens is you use your, and then sensation goes to the occipital lobe in the visual cortex, and then it will be transferred into a language form, not in a picture. It's different when you are looking at an abstract picture. So that will be perceived as a picture and then analyze it in the Wernicke area. In you are reading a book, it will be as a language, not as a picture. Okay? Kaya we're not like a camera, a cell phone na you will try to take a snap picture of the entire book. So it will be translated into a language so that you can perceive, you can understand what is written in the book. So that's the function of the angular gyrus. It's near the also the visual cortex. So information coming from when you are reading a book, so it will go to the visual cortex, and then it will go to the Wernicke area through the angular gyrus, and this will be analyzed. The words in the book will be analyzed so that you can understand what is written in the book. In the same way as you can understand what you can hear. So if you listen to some words, you can understand that through the processes in the Wernicke area. But if we're talking about visual language, it will be through angular gyrus. So I will show you later how we are able to connect the information if it's a visual language or an auditory language. But suffice to say, angular gyrus is needed to make meaning out of the visually perceived words. So more on reading siya. So we now understand the function of angular gyrus because if there is a damage or impact of the angular gyrus, as shown in the picture. Na-amaze ako sa nakuha ko siya sa internet na umiikot the position of the angular gyrus. So if there is infarction to that area, you will have, you can see the word, but you cannot understand the meaning of the word. Parang nakasul, if it's written in the paper, I love you, I like you, you can read. You can say that, I love you, I need you. But you really don't understand, he is proposing to me. Parang ganun. You cannot perceive you cannot understand the meaning of what is written, damage of the angular gyrus. So a person can still have language comprehension through hearing, but not through reading if you have damage to the angular gyrus. So that's what we call as dyslexia. Okay, so both if there's a damage to ability to understand what is inability to understand what is written, then dyslexia yung tawag niyan. Okay. Area for naming objects. This is another portion. Parieto-occipitotemporal Association area. Basically, memory or understanding or trying to recall the name of a certain object. So there are there. So for example, if you close your eyes and you just try to hold on a certain object based on the sensation from your hands, you can identify the name of an object, diba? Or hindi mo siya nahawakan, but just look at the object, you can identify the object, and that's the information will go to this area for naming object in order to identify the object. So pag bata, diba, we teach the child that this is a toy, this is a ano ba, toothbrush, parang ganun. Okay? Naming of object. Bakit kaya, no? Why do you think there is an area just for naming objects? I think because it's important in our daily life. So if there's a damage to this area, you cannot identify cell phone, pencil. I mean, you can see that it's a cell phone, but you cannot really tell or easily extract. This is a cell phone. So kung papapiliin ka, which is a ball pen or a pencil, mahihirapan kang mag-identify. Kaya yung compute, ang galing ng brain natin, no? We can name objects. So, di ba in the computer, pinapapili ka which picture has a bicycle. Di ba? I-click mo yung tatlong bicycle, tapos yung tatlo truck. Kaya walang ganong ability yung computer, but humans have that ability because we have an area for naming objects. Okay? Prefrontal. Let's go to the second association area, that's prefrontal. Again, we thought that the intelligence is because of the prefrontal association area, because the prefrontal area is so big, it's large as compared to other animals. Compare it to monkeys, mas malaki yung prefrontal area natin. That's why we thought that intelligence is because of the prefrontal area, but it's not. I will tell you nasaan yung location of intelligence later. So prefrontal area is for thought process. So if you are examination, the teacher is analyzing your thought process on the case, that's because of your prefrontal association area. It receives information from the cortex, primary, supplemental, and also from the sensory cortex. It receives information from visual, auditory, and then try to analyze everything in your thought process. So, parang din siyang intelligence, but hindi talaga. There is a specific area for intelligence, but suffice to say for thought processes, this is more of the prefrontal area. Important for elaboration of thoughts. So if you are looking at an abstract picture, magkakaiba-iba yung interpretation, and you can probably listen to intricate way of explaining the abstract picture. Yung iba naman walang thought process, so magkaiba-iba siguro yung tao. And that's because of the function of the prefrontal association area. But this area can be learned. This area can be learned. For example, meron kang abstract picture, you were asked initially, hindi maganda yung pagkaka-explain mo, pero tinuruan ka ng sagot. And then the next time around, iba na yung kasama mo, you are asked to interpret the abstract picture, mas magaling ka na sa iba. So, ganun siya, the prefrontal association area. Okay. Limbic, the third association area is the limbic. And this is important for behavior, emotion, motivation. Dito daw yung motivation mo to study. For example, you have an exam, malayo pa yung exam mo, but if you are motivated, you are going to read ahead of time. That's the limbic association area. So you really have to pray every day that your limbic association area is highly stimulated so that you will be motivated to study and ahead of time. Okay. So motivation. So there are psychiatric patients, they're not really motivated to, wala silang ambition, no? That's probably a damage to the limbic association area. Okay, so understand behavior, emotion, motivation is on the limbic association area. Okay. Face. There is beneath the cortex, we have that area for facial recognition. So if you ask yourself, bakit kaya, no? We have naming for objects, we have also, but just specific for a face. That's because every day we encounter, we communicate to a lot of people, and then we need to get information based on facial expression. Galit ba siya? Happy ba siya? Ano ba? Dissatisfied or not satisfied? Parang ganon, no? The way you smile. Each person has a specific characteristic on the face. May nunal ba? Something like scar? Parang ganon. So this is the area for that recognition of face. So if you have a damage to that area, you can identify that it's a person, a male or a female, but you really cannot identify na siya pala yung kapatid mo or mother mo because you have inability to recognize the face. By the time that the patient speak, probably then you can identify the person, but by looking at that, then looking at the person, nahirapan ka mag-analyze. That's prosopagnosia. Okay? All right. So let's talk about Wernicke's area. I've been talking about the area for intelligence. Ito yon, Wernicke's area. It's near, look at the area, it's near the somatosensory area, it's near the auditory area, it's near the visual area, it's the center of intelligence. So if you are wondering why some people are right-handed, left-handed, why is the left hemisphere more dominant than the right hemisphere, what creates the dominant, or what makes the hemisphere more dominant to the others? Because of the Wernicke's area. If the Wernicke's area is on the left hemisphere, that automatically the left hemisphere will become the dominant hemisphere, and the right will be the non-dominant hemisphere. So if a person is right-handed, it means to say that dominant hemisphere is the left. But if the person is a left-handed, happy yan. Some of the left-handed person, the dominant hemisphere is on the right, meaning the Wernicke's area is on the right. But there are left-handed people na alam mo yun, vice versa. They can write on the left, they can also write on the right. Parang hati. So probably some of these patients, their dominant hemisphere is still on the left, but they are left-handed. But suffice to say, what this is the Wernicke's area is, kung nasaan yung Wernicke's area, that's the dominant hemisphere. And so it's the center of intelligence because that's where we interpret language. Now you know that the center of intelligence is the Wernicke's area, but again, I'm trying to tell you that we humans are intelligent because we are capable to communicate through language. So we have a different form of language. We can communicate through words. We can communicate through actions. We can communicate through sound lang yun. We can communicate through yung mga bulag. Ano ba yung tawag niyan? Yung mga bulag? Anyway, kalimutan ko yung term yan. Anyway, so that's because of language. So humans are intelligent because of language, and we are capable of creating a language because of the Wernicke's area. And that's why the center of intelligence is the Wernicke's area. Okay, dominance. I've been talking about dominance. If the Wernicke's area is in the left, the dominant hemisphere is the left. And 95% of the time, it is the left hemisphere that is dominant. And so most of us are right-handed. So if you are a left-handed, then most of your dominant hemisphere is the right. But there are also some left-handed person that their dominant hemisphere is the left. So these are left-handed na can also be right-handed. May ganun eh, may ganung left-handed person na vice versa sila. Okay, so they believe that yung dominance appear to be on the left. That's because the left temporal lobe at birth is a little bit larger than the right. But pag the adult ka na both, it's the same size, right hemisphere, left hemisphere, both are the same size. So it's not really on the size, but the presence of the Wernicke's area. So what happens, according to the theory, is that because at birth, the left temporal lobe is bigger, this is more used. As you grow older, parang the left hemisphere is being used, and that's why it becomes it becomes more dominant. Parang ganun. That's where the Wernicke's area would develop as compared to the right. So that's their theory. But it's not on the size. The dominance is not on the size because both the right and left hemisphere is of equal size at birth. So what determines dominance is not the size of the hemisphere, but the presence of the Wernicke's area. If the Wernicke's area is on the left hemisphere, then the left hemisphere becomes the dominant area. Okay. Although Wernicke's area is the center of intelligence, and if it's on the left hemisphere becomes the dominant hemisphere. But there are also skills in the non-dominant hemisphere, and these are interpreting music, the non-verbal visual experiences. This is more pronounced on the non-dominant hemisphere. Yung spatial relation between person and the surrounding, body language, intonation, yung, di ba may mga taong magaling yung intonation, yung diction, yung may mga volumetric, yung sabi ni teacher from Cebu, yung tumataas, lumalaki yung voice, yung ganon. That's on the non-dominant hemisphere. Probably many somatic experiences related to the use of limbs and hands. Okay. Higher intellectual function of the prefrontal association area. So again, to emphasize, the center of intelligence is not on the prefrontal association area, but if we remove the prefrontal area, there are also some activities that cannot be performed or some functions that are lost. And this includes the ability to solve complex problems, mathematical siya, unable to string together sequential tasks, unable to learn several parallel tasks. The aggressiveness sometimes is decreased, but sometimes it is markedly pronounced. And social responses, di ba yung may mga psychological problem, naguhuhubo in front of a lot of people. So that's probably from the damage of the prefrontal association area. And to talk and comprehend language, the patient can still talk and comprehend language, but they are unable to carry through yung maintaining the thought process. So nasa prefrontal association area siya. And a patient could also still perform most of the usual patterns of motor function that they had performed throughout life, but often without purpose. Okay pa bang signal? Or nawawala-wala?
Okay pa po, Doc.
Ay, thank you, Lord. Okay. Concept of working memory. So some of us are able to carry out a certain activity because of a working memory. And ito yung concept of prefrontal area, another activity of prefrontal area by the concept of working memory. So, for example, doctors are, for example, ako, I have trained as an internist and then a cardiologist. So based on that, in that process, we are trained how to identify patients who will eventually die and how patients who will eventually, most likely to survive. That's prognostication. And this is an ability in the prefrontal area. Plan for the future. Yung mga animal, di ba, hindi naman sila nagplan. But we can plan for the future. Let's say, build a tower and then build a park, something like that. We can plan for the future. You can plan ahead of time. If you want to be a cardiologist, if you want to be a neurologist, if you want to be a surgeon. So that's your ability to plan for a future. And then sometimes we can delay our activity because we want to achieve more. Since ito yung, if I have to understand this, correlate this, ito yung mga hunter, di ba? Hindi naman sila agad-agad nag-shoot lang, but they have to wait for the proper time and then that we trigger the bullet and para successfully. So the incoming sensory signals, the sensory information can be wait until the best course of response is decided. Consider the consequences of motor actions before they are performed. So we don't do any, pag galit na galit ka, we can sometimes inhibit ourselves That's because of this ability in the prefrontal area. Solve complicated mathematical, legal, or philosophical problems, correlate all avenues of information in diagnosing rare diseases, and control our activities in accord with moral laws. Di ba? So we have morality. Animals, wala namang morality, di ba? May mga animals that they, di ba, nagsisex na kahit may mother and son. Pero tayo, di ba, parang taboo sa atin. We don't do that. And that's because of our prefrontal area. Okay. So, for example, language. Paano ba yung interpretation of language into an output? So, if you hear a certain word, it will be perceived by the primary auditory area, and then it will be transported through the Wernicke area, and then that language will be analyzed. And if you need to speak, it will be transported to the Broca's area through the arcuate fasciculus. Take note through the arcuate fasciculus. And then in the Broca's area, since you have decided the words that you are going to speak, then that particular area has to be stimulated and then transported to the motor cortex to stimulate the specific muscles in your mouth and in your throat, in your larynx to speak the word. Now the intonation, the voice, the volume will now differ based on the processes in the Wernicke area. For example, you heard na minumura ka or gintatamay ka, something like that. Then you will be able to analyze that words, and then when you speak, diba, magagalit ka in a loud voice, something. So these are the input and output in the communication. So you can also understand language through visual input. So this time the input will go to the primary visual cortex, and it will be transported to the Wernicke area via the angular gyrus. So via the angular gyrus. So this time you will now be able to interpret the written words, and then if you need to speak what is written, it will now be transported to the Broca's area and then stimulate and transport to the motor cortex, and then stimulate the muscles that you need to stimulate in order to speak the word. So that's how the processes of speaking a heard word. Okay. So damage to the angular gyrus. You cannot speak a written word, but you can speak a heard word. Okay, that's the difference between the two. Okay, communication. If you have Wernicke's aphasia, ibig sabihin, the patient will be demented because that's the center of intelligence. You can still see words, but you cannot interpret that. And so that's what we call as Wernicke's aphasia. Whereas Broca's aphasia, this is motor aphasia. You can still understand. If the words are written in a paper, you can understand that, but you cannot speak the words written. However, you can still nod by yes or no. You can identify that the patient can really understand, or the patient can write, can write an answer to the question in the paper, meaning to say you will understand that the patient can still understand and can have still the intelligence by understanding the language written on a piece of paper. Whereas Wernicke's aphasia, wala. They are demented. So the other term is global aphasia because really the patient cannot understand it. Magmamumble pa siya ng words, which means that the patient can still speak, but no understanding of the written word or heard word. Okay. So corpus callosum and anterior commissure, as you can see, there is a connection between the right and the left hemisphere, and this is important for activities that are parallel or simultaneous, that you need to coordinate both your arms and extremities. For example, if you are climbing upstairs from a tree, in a tree, tama ba? In a tree or from a tree. So pag paakyat ka, kailangan mo yung coordination of the corpus callosum anterior commissure. So ito yon, the dominant hemisphere to the motor cortex on the opposite side of the brain. So if you cut the corpus callosum, it will prevent transfer of somatic and visual information from the right to the left. And people whose corpus callosum is completely sectioned have two entirely separate conscious portions of the brain. All right. Let's now go to memory. So paano nagme-memorize? So it can either be through facilitation. So if you facilitate a memory, that will be a longer, matagal siyang memory. It will last for a few months to years. But if it's an inhibition, then it will be a short period of time, short memory. So minsan we pray, Lord, I hope I can memorize everything, but don't you think it's going to be bad for you? If everything, lahat na memorize mo, lahat na tatandaan mo, that's not going to be good for you. Because you can still remember yung when you were a child, nagsuka ka, the time when you were constipated, natusok ka, every time gintukob ka tubak, you can still remember that. Di ba nakakaloka? Every time tinukob ka hinamok, you can still remember that. All the sensation in your skin, you can still remember. So it's going to be not healthy anymore. So all the pain and suffering, you can still remember. It's going to affect your mood. Diba? And that's why most of our memories are negative rather than positive, which means that we need to not remember everything. So almost 90% of the time, you will not be able to remember. You only need to remember what is important through positive memory or synaptic facilitation. Okay? So the process of synaptic facilitation is positive memory, but synaptic inhibition is through a process of habituation, and that will be a negative memory. Ang hirap no, bakit pa kasi may mga terminology, kaya sa exam nakakaloka pa siya. Hindi na lang long-term memory and short-term memory. But when we talk about synapses, there are two, synaptic facilitation and synaptic inhibition, and you will understand later. I will explain it to you. Okay, so we differentiate memory in terms of a short-term memory, long-term memory, but we can also classify memory according to declarative memory or skill memory. Okay? So declarative memory muna. So basically means memory of the various details of an integrated thought, memory of the surroundings, memory of time relationships. So for example, let's try to imagine Santonini Church. If you are seated at the center of Santonini Church, try to imagine the altar on your left side, on your right side. So let's try to go out on the right side. Nandoon yung ano ba nila, convento, main building nila for, anong tawag yun? And then pag lumabas ka, merong coffee shop dyan. Pag diretso mo pa, may something like hotel. Pag talikod mo, may bahay dyan na hindi ko alam kung sino may-ari, parang feeling ko mayaman. Then marami nakapark na sasakyan pala. Pag diretso mo pa to the left side ng Santonini Church, may school, cemetery, something. Di ba? You have that memory, that's declarative memory. Time relationship, you can remember some of your friends in high school, elementary, and the causes of an experience. For example, nag-away ako yung mother ko ng neighbor just because hindi sinauli yung Tupperware. These are some memories that you can still recall. You know the cause of the experience. And memory of meaning of the experience, memory of one's deductions that were left in the person's mind. Skill memory. So, yan yung best example, yung tennis, di ba? Pag, by the time the hitting a tennis ball, including automatic memory. So, size of the ball, titingnan niyo yung ball, pakarating na, then calculate the relationship. Di ba? makakalculate niya kung saan. Otherwise, pag hindi niya makakalculate, then he will miss the ball. And deduce rapidly the motions of the body para mabilis. Kasi kung bagal-bagal mo naman, kahit na-calculate mo, hindi mo rin matatamaan yung ball. So these are skill memory. So we can classify a memory according to declarative memory or skill memory. But most of the time, we classify memory as short-term, intermediate, or long-term. Okay, short-term memory. So short-term memory, it is a short-term memory because of presynaptic inhibition. Okay, if it's a presynaptic facilitation, it can be a long-term memory. So what determines a memory can either to a short-term or a long-term is based presynaptic facilitation or inhibition. And we are going to discuss this neurotransmitter chemical release in a presynaptic facilitation and inhibition, creating either a short-term memory or a long-term memory. Again, inhibition is more of a short-term memory, kaya nga siya short-term lang because it was inhibited. But if it's facilitated, it can be a long-term memory, so you can still remember that for a few weeks to a month. Intermediate long-term memory, ito yung mga few, few weeks, few minutes to few weeks. So you can still remember your breakfast this morning. That's a short-term memory. But after a week, baka hindi mo na maalala yun. So this is how it happens. So we have sensory terminal and we have facilitator terminal. Di ko maituro, so please look at the picture. We have two terminals there, the sensory terminal and the facilitator terminal. So when we talk about inhibitory synapses, meaning short-term lang, you only stimulate the sensory terminal. So the sensation arrives at the action potential there in the presynaptic neuron, and then release of calcium entry, and the neurotransmitter released into the postsynaptic neuron. And then the postsynaptic neuron is stimulated, action potential there. However, in a few minutes, the impulses will just die down, parang pababa ng pababa. It will decrease. Okay, so that's in the process of inhibition. Hindi siya augmented. Unlike if there is a stimulus coming both from the sensory terminal and a facilitator terminal. For example, a noxious stimulus, it's a pain. And noxious stimulus most likely will stimulate both the sensory terminal and the facilitator terminal. And what happens is, if the facilitator terminal is stimulated, it will release serotonin, and the serotonin will go to receptors in the sensory terminal, and this serotonin will release. If the receptors are stimulated, it will activate adenylate cyclase, creating more cyclic EMP. And the process, if the cyclic EMP is stimulated, will be different because the potassium channels are going to be inhibited, and potassium channel will not exit. Okay, if the potassium channel will not exit, it's going to prolong the action potential. So it's going to prolong the action potential. At the same time, it's going to increase the calcium entry. And so what will happen is, if this stimulus go to the postsynaptic neuron, it will be augmented, parang pataas ng pataas yung stimulation in a prolonged period of time. That's why this is a process. If the facilitator terminal is stimulated together with the sensory terminal, it's going to produce a long-term memory. But if only sensory terminal is stimulated, that's going to produce only a short-term memory. So everything I have explained, I've written there because minsan hindi na tayo nagbabasa ng book, so kinapit-paste ko na lang. Okay? Now, that's for intermediate long-term memory. But for a long-term memory, kailangan ano siya, there should be hindi lang neurotransmitter or chemical stimulation through facilitation. There must be structural changes in that neuron that can create a long-term memory until this long-term memory is consolidated. So The structural changes to create a long-term memory are: one, an increase in vesicle release sites for secretion of neurotransmitter substance, an increase in the number of transmitter vesicles released, an increase in the number of presynaptic terminals, and changes in structures of the dendritic spines that permit transmission of stronger signals. Okay. Consolidation memory, ibig sabihin, if paulit-ulit mo yung memory, you try to recall a short-term memory, it will now create signals, it will be augmented, and then if you keep on repeating that, rehearse that memory, the memory will have not chemical, hindi lang chemical, but also physical and anatomical changes. And this will create a consolidated memory that will be long-term. So when we say consolidation memory, hindi lang on that area, but it will synapse to other association area, creating a consolidated memory. And this process will require 5 to 10 minutes for minimal consolidation to 1 hour or more for a strong consolidation. So if you need to memorize something, you have to keep on repeating that for 10 minutes to over an hour. And then every hour after that, try to recall, then it will create a consolidated memory. So kung magbasa ka ng libro, natapos mo yung buong book, wala ka namang maalala, bagsak ka rin sa exam. Whereas if you just try to focus, kahit konti lang yung nabasa mo, but you try to memorize and you keep on repeating some important information over and over na importante lang, and then swerte mo, yun ang lumabas sa exam, you have a higher chance of passing the exam. Kaya nga, when you read, you need to memorize high yield. Yun yung, ano ba, the process of passing an exam is memorizing high yield. You don't memorize everything, lahat ng nasa paragraph, pati yung the, if, of, alam mo yun, may mga ganun. Ganun din ako mag-memorize when I was the first year. Kailangan yung buong sentence, yung buong paragraph memorize ko. Makakaloka yan. Eventually, makakalimutan mo. But intelligent people try to memorize single words and associate it with other, alam mo yun, parang they try to memorize lahat ng 40. Then, you will, pag high yield ang i-memorize mo, you have a high chance of passing the exam. Okay, rehearsal. So, by keep on repeating a certain activity, you will memorize. You will be able to memorize. And this is important in dancers, diba? Nag-rehearse. So, paulit-ulit na minimemorize yung sayaw, diba? Yung activities, yung performance, lahat yan, yung pagkakasunod-sunod, yung position mo, pupunta ka sa right, pupunta ka sa left, and then through rehearsal, these information are going to be created in a long-term memory and then consolidated, and then that's the time you have a long-term memory. This phenomenon explains why a person can remember small amounts of information studied in depth far better than large amounts of information studied only superficially. So kung gising na gising ka, kaya kailangan maghanap ka ng time for you to read. For example, by experience, I am reading for like 5 hours and then wala naman akong naintindihan. Whereas I sleep and then wake up and then pag-gising ko, I read only for 15 minutes pero sobrang dami kong na-absorb. So these are things that you have to learn in order to pass the exam. Okay? Antegrade amnesia is inability to memorize new skills. So if you have a problem in the hippocampal area, you will have a damage of anterograde and some degree of retrograde. So it means to say you can still remember your past experiences, but learning new skills, by the time you had an accident or an infarction or stroke, you will have difficulty learning new things, okay? And anterograde amnesia, again, is a damage of the hippocampus. It will cause more anterograde, but some retrograde. When we say retrograde amnesia, you will forget your past, but we have recent past and distant past. So in retrograde amnesia, you will forget first the recent past, than the distant past. And the explanation behind is the distant past has been rehearsed and the distant past have other parang it has been memorized in other association areas. So mas ano siya it has been consolidated. So your memory, if you have a retrograde amnesia, that patient cannot recall within a month, but can still recall yung childhood niya. But if that retrograde amnesia progresses, then eventually makakalimutan din niya rin yung sa childhood niya. So in retrograde amnesia, the recent past is affected first as compared to the distant past. So if you have a problem, you produce retrograde amnesia and without causing anterograde amnesia. I think that's the last slide. Yay! We're done! I'm glad. May nag-chat. Volumatic. Thank you. Nakalimutan ko nga. Volumatic, di ba? Kakatawa si teacher. Yung volumatic. Increasing and decreasing voice. Okay, any question? Ang dami nyo ng aaralan nyo. Ang dami nyo pag-aaralan. So we talk about spinal cord. We talk about motor. We talk about cerebral cortex. And then next Monday, we will talk about autonomic nervous system. And then finally, Wednesday, this coming Wednesday, before tayo mag-hiwa-hiwalay for the Holy Week, this Wednesday, 10 o'clock, we will talk about autonomic nervous system. And then Monday, April something, we will talk about cerebral blood flow. So 5 chapters for your exam. Diba? Exam. So any question? May tanong ba kayo, naintindihan nyo ba? If you read the book, somehow you will, if you listen to my lecture and read the book, then at least siguro makakatulong naman yung explanations ko. But you have the slides already. I will get exam based on that slides lang kasi that's the summary of the book. So kung tamad ka, you can just read the slides. But if you want to understand everything, all the concepts, try to read the book, okay? Any question? Good morning, to. Paano po nag-work yung associating areas sa mga taong may photographic memory o yung nare-remember yung nangyayari sa buhay nila everyday? Wow! Meron talagang mga ganun eh. Sa TV lang yan, Kulor. Mahilig ka siguro manood ng Korean novela, no? May mga ganun. I also believe there are people who are really intelligent and I think their Wernicke area are so pronounced and they try to remember. So association area yan eh. I think it's more of association area. They just try to memorize not only on a single area of the brain, but try to associate that. You will try to create neurons for memory in other areas. Parang ganun siya. So one time I attended a lecture on how to memorize things. And yung concept nila is through association. So when you memorize daw, it should be through association. So for example, if you have difficulty naming a person or memorizing the name of that person, try to associate that with the face or knowing the person through his past, something like that, then maaalala mo siya. Try something like that. So for example, ikaw kinikilala kita, taga saan ka? May jowa ka na, ganun ako eh, kasi mahirap akong mag-memorize. So I try to, after I attended that lecture, I do that na. So through association ang pag-memorize. So I think these people who have very good photographic memory, they try to associate it. Hindi lang, they try to stimulate not just the visual cortex, but also auditory. I have a classmate na cum laude. And then, Diyos ko, Lord, kung mag-aral siya, ganito, no? Transcribe niya yung book into the sa notebook niya in a summarized form. And then, after niyang i-summarize yon yung mga parasite, pakopya naman sa pinapotocopy namin yung notebook niya. Oh, sorry. And then, meron pa siya, aside from a summarized form in her notebook, nagre-record po siya. Nire-record pa niya doon sa recorder niya yung buong sinulat niya sa notebook niya. And then overnight, pinapakinggan niya. Nakakaloka. Kaya pala, palitalino ng trader na to. So, kala mo yung classmate mo, hindi nag-aaral, pero palaging number 1 sa exam. Meron yan siyang style. Hindi mo lang alam, nag-aaral yan sa bahay. Ang bilis lang niyang mag-pick up. And then, he or she has developed a way to create association. Okay? So, ang memory, ang intelligence kasi sometimes can be learned. No? For example, yung mga average students can be great doctors kasi nati-train. Kaya nga may training. And based on experience, you can learn something. So for example, ngayon, I am a cardiologist and an echocardiographer. Yung classmate ko na number 1, ay, Diyos ko dahi. If we talk about cardiology, mas matalino na ako sa kanya. No? Kahit mas matalino siya sa akin. That's because I have experienced, I have trained for a longer period of time kaysa sa kanya. So, when we took the exam in physiology, for example, mas mataas yung score niya sa akin when we were first year. Pero ngayon, kung mag-take kami ng exam, I think I will have a greater score compared to her. And that's because I am teaching physiology and every year, paulit-ulit kong binabasa yung libro. So, ganun siya. So, yung people who have photographic memory is also developed. It can also be developed through practice. And the answer to that is 1, genetic, but 2, through association area and through experience. Practice lang po. Doc, do you believe in memory-enhancing meds like memory plus gold? Oh, hindi. As of now, hindi. I think that neurons can be converted into memory cells. And so eventually, if these neurons, if not used, or if infarcted, or through aging, namamatay sila, di ba? Autophagy, di ba ganun? Or atrophy, will eventually die. So in order to have a good memory, you have to keep on stimulating these memory cells, repeat and repeat a certain rehearse and rehearse. Kaya nga di ba yung teacher have good memory because paulit-ulit nilang binabasa yung libro. And so people who are reading a lot have good memory as compared to people who are not good readers. And that's because if you keep on reading, marami kang na-stimulate na neurons eh. Nare-rehearse mo siya, paulit-ulit mo siyang nare-rehearse. Kaya if you want to be intelligent, you need to keep on reading. Kaya nga alam niyo, gusto ko na yun, magbasa. Pati mga novel, kasi hindi maganda yung hindi maganda yung I'm not articulate. Ang hirap kong mag-pull ng words. Kasi nga, hindi naman, may mga, I grew up in a family, hindi naman nag-i-English sa bahay. So, if you are in a house na puro nag-i-English, ang galing mo mag-English, pati yung intonation mo, yung language mo. Pero, it doesn't mean matalino ka. Magaling ka lang mag-English, pero bobo. May ganun yan, no? So, ito naman, hindi magaling mag-English, pero matalino pagdating sa exam, halimaw. Pero, pa-Englishin mo, pangit. Kasi nga, Bisaya tayo. So, can be rehearsed. Did I answer the question? Memory plus gold? Hindi, I'm sorry, because there's no study on that. Let's say you give memory plus gold to 10,000 population and 90, di ba? Parang 9,000, talagang there is improvement. And that's why they cannot show a study, something like that. We should be science, di ba? Parang we should be based on study. We should be able to produce a randomized controlled trial. So merong lalabas na mangustin, kemi, ba't napasulat yan? They have FDA approval for safety, but they have no therapeutic claim. And that's because they have not conducted a study that 10 out of 10 patients, 9 talagang nagbongga yung memory. Ang nangyayari yan, isa lang yung bongga yung memory, and then interviewin siya ako, Hirayan Mambulaw, nagtumarhini nga manggustin, man bonggang-bongga good ang akong paka-memorize. Di ba? Ganun sila. That's why there is no therapeutic claim, because in order for us to really believe that these drugs can improve memory, they must be able to produce a study that really there is a robust result showing that it improves memory. But up to now, there is none. And that's why I would say I don't believe on it. But if they can prove to me in the future, they conduct a study, then I will believe in it. Kaya nga yung mga ganyang di ba makasulat yan sa not approved therapeutic claim? Di ba? Tama ba? Meron bang claim doon? Baka hindi ko lang alam. Kahapon nag-release na sila ng study. Hindi ako na-inform. But up to this point, I have not received a study. Did I answer your question? Doc, good morning po. What could be the explanation po for people who could recall things and even one time lang nila narinig until they could recall it even after several months or years? And the explanation there is because of facilitation. They have facilitated that memory. And at that time, when they are stimulated, they are in awake stage. Parang gising na gising sila. And it caught their attention. It caught their attention and interest, motivation. And so that memory, hindi lang yan, once lang nila na-encounter yan, pero paulit-ulit nilang na-remember yan. So meron ding times, for example, meron ding times na once mo lang siyang naisip, pero naalala mo siya the next time. And that's because the stimulus is through a facilitation. Again, it can be facilitated if you have that interest. Most of noxious stimuli are in a facilitation. Kaya pag sinaktan ka ng jowa mo, nasaktan ka, all of pain or noxious stimuli, because these are important for our survival, will be in a facilitated. Okay? So the answer to that is specifically more on facilitated memory and consolidated memory. But how they do that, I really cannot explain. Again, I think it is more of if it caught your attention and then rehearse that or put that in a, parang it's important to you, no? It's important to you. Kaya nga, di ba yung mga traumatic experience, mas naaalala natin, it's because pain or noxious stimuli is through a facilitated memory rather than an inhibition. Doc, sa mga taong malalaki yung IQ, does their brain anatomy differ? Hindi! There's no difference. That has been debunked based on study. Yung brain cells natin, all the anatomy of our brain is just the same with another one. But how we use it, how we train it. Kaya nga, di ba nasing sila, wala naman talagang bobo except if there is an infarction to the Wernicke area or infarction to the other. Or the development of that brain talagang hindi nag-develop. But if the brain is developed, somehow maano natin yan, matuturuan natin. Kaya nga ayaw ko magbagsak ng student kahit bagsak na bagsak sa exam. Kasi I believe that can be developed through, if the student is motivated, paulit-ulit lang siyang mag-aral, I think matututo. Marami akong classmate ha, just telling you ha, just an example ha, marami akong classmate na nag-exam kami dati, kung score nila 35 lang, pero eventually pinasa sa deliberation. But now, Diyos ko dahi, neurosurgeon, pumasa sa oral exam. As in, pumasa na siya sa oral exam. And then, quite a good practice as a surgeon. See? Nade-develop siya through practice. Parehas ang brain cells natin sa mga intelligent people with IQ and those without IQ, same yung development. But I think it's more of yung genetic development, yung experience niya, and then paano niya dinevelop yung isang area niya compared to the other. Parang ganun, di ba? Hi. It's more of genetic also. But if you're just, specifically, if we're going to answer the question, pareho bang anatomy? The same. But yung association, yung memory, magkakaiba-iba na tayo based on experience and develop. Paano kanya grow yung, di ba may yung example na yan is yung mga Chinese sa China, yung pagkaanak pa lang, ikaw, swimmer ka, tapos pupunta, as in, they will be trained from until lumaki sila as a swimmer. Kaya na di ba pinapagalitan na yung China because of that. Pero wala tayong magagawa kasi ganun yung country nila. So, dinidevelop silang as acrobatic, di ba? Hanggang sa paglaki. And then, natitrain sila na ganun. Pwedeng ma-develop siya. Did I answer your question? I hope I answered your question. Sa physiology of the brain, doon na tayo magkakaiba-iba. But generally, the physiology of the brain is the same. But yung memory, yung association area, yung develop, yung pag-create ng memory, magkakaiba-iba na tayo. An example to that is me as a cardiologist. Mas magaling ako sa friend ko na number 1 siya, cum laude siya, nang mag-classmate kami. Pero if we talk about cardiology, mas magaling na ako sa kanya. Kaya nga tumatawag siya sa akin sa case niya in terms of nag-AMI na patient, Rai, help me, ganito ang case. And then tinuturoan ko siya what to do. Na-gets mo? So, the same naman yung anatomy and physiology, pero mas matalino lang siya sa akin. But in terms of a certain specific knowledge, mas matalino ako because yung development ng experience ko, nagkaiba na. Ganun din. So, if pulmonologist siya, in terms of pulmonology, syempre, mas bobo talaga ako. So, I have to call her, tell what to do. I have a case, something like this. Something like that. Okay? And then yung classmate ko na surgeon na ngayon, na yung scores niya tig 45 lang sa exam natin, nire-refer ko sa kanya. Kasi alam nga naman ako yung mag-opera. Wala. Ano namang alam-alam ko sa pag-opera. Di ba? Although, nag-rotate in surgery. Pero just ko, Lord, pag mag-opera ko ngayon, parang mamamatay siguro yung pasyente. So see, the experience, the memory is different. Pero siguro, pare-parehas pa rin naman yung anatomy and physiology as a whole. But there will be differences because of development of experience and yung creation of memory and association chemistry. Nakakaloka, no? Yung mga tanong yung ganyan, alam nyo, wala talagang ano yan eh. We still have to understand that in terms of kailangan yung maging magaling and then pag-aralan nyo in neurology. Maging neurologist kayo, maging scientist kayo at pag-aralan nyo. There is still a vast of knowledge that we need to understand in terms of the cerebral cortex. Yun, nasa libro nyo yan. It's in the, nasa introduction ng chapter na to. You still have to learn a lot of things. Kasi wala pang nagpo-volunteer na studyhan yung brain niya and then eventually mamamatay siya. Okay, yung questions, ibig sabihin na-stimulate ko yung brain niyo. Try to develop a way in memorizing things through association and through interest. If you are highly motivated to learn, mas marami kang matutunan. Kaysa yung pinirit-rit, bisan ka magbinasa for 5 hours, Diyos ko dahil, wala kang maaalala dyan. Kaya matulog ka, and then, di ba pag board exam sinasabing, baguhin nyo yung way of studying, dapat by 12 o'clock matulog ka na. No? Dapat by 12 o'clock, by hook or by crook matulog ka na, para paggising mo bukas, maganda yung utak mo. Ganon. Ako, na-develop ko na rin yung way of learning. Kailangan maganda yung mood. Kailangan I'm so interested. Parang masaya lang, ganyan to. Facilitation, baklang to. Memorize ko yan. Ganyan. So, ganyan. Parang you will develop way how to memorize. Ay, sorry. Dami ko na bang sinasabi? Any more questions? Going once? Going twice? Going thrice? Thank you very much for your time. I'll see you on Wednesday, 10 o'clock, Autonomic Nervous System. Good morning.
Thank you.